So today we're going to be doing the extraoral and intraoral examination. Prior to performing this, the clinician would wash their hands for 30 seconds accordingly. They want to be following dress code, which our clinician is today, with her head cap on, her level 3 mask, her eye safety glasses, and her overcoat, as well as 2 pairs of gloves to begin. We do this exam because we want to feel for any abnormalities, any lumps or bumps that could be causing patient discomfort, which we would get the patient's feedback from at the beginning prior to performing. So first we're going to start with general appraisal. So the clinician would just look over the patient and make sure that she doesn't see anything off the bat. And then she's going to start on the anterior border of the mandible. She'll then go to the auricular nodes bilaterally using a circular motion, and then to the occipital nodes bilaterally on equal sides. Then the temporalis muscle and the TMJ. She's going to ask the patient to open and close
and side to side,
and move the chin side to side. And then the parotid gland bilaterally as well. The masseter muscle, asking the patient to clench. And then she'll move to the submandibular and submental region of the mandible.
swallow,
Then to the sternocleidomastoid muscle, where she'll have the patient turn from one side, palpating down the sternocleidomastoid muscle, then to the other side, doing the same thing. She'll then palpate the upper and lower deep She'll then palpate the sternocleidomastoid muscle, along with the upper and lower deep cervical lymph nodes located on either side of that muscle, on both sides of the neck. And then she'll move to the larynx, one hand, and ask the patient to swallow. Then to the thyroid, palpating the right lobe and the left lobe. And then the supraclavicle nodes located on the clavicle, and she'll feel that bilaterally. And then Maddie, the clinician, will remove her overgloves to begin the intraoral exam. Now we're beginning the intraoral exam. The patient would have previously rinsed with mouthwash for 30 seconds before the clinician could look in throughout the mouth.
Can you put your glasses on for me, and I'm going to lay you back.
Safety glasses should be put on at this point anytime instruments are going anywhere near or in the mouth. So the first part of the intraoral exam is the cursory screening. This is visual only. The clinician will not be using his or her fingers. The clinician will be performing a cursory exam, looking through the vestibular mucosa, the mucobuccal fold, the palate, the tonsillar area, along with the uvula and the tongue, the floor of the mouth, the gingival unit, and the retromolar pads. This is now a combination of the intraoral exam. The clinician will now use his or her fingers to look at the lips and labial mucosa, the frena, all throughout the mouth, and the buccal mucosa, feeling for any abnormal lumps or bumps. This is now the intraoral exam. The clinician will begin by looking at the retromolar and maxillary tuberosity area. She'll then look at the gingival unit and alveolar ridges. And then the mucobuccal fold and vestibular fornix. She will then move to the floor of the mouth, where she would ask the patient to lift their tongue to the roof of their mouth. And then to the hard palate, where she can feel with her finger. to the soft palate and back to the uvula, oropharynx, and tonsils, where she'll ask the patient to retract her tongue and say ah. And
That's it.
she will then ask the patient to stick out his or her tongue, wrap it in a cotton swab, and look on either side. And that is the remainder of the intraoral and extraoral examination for today. If any abnormal findings were found, the clinician would then document those in his or her notes and watch for them for next time.